To Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. If you listened to the show last week, you met Stephanie Pigeon, the founder of Affiliated Associates. And as I knew what was going to happen was that half hour goes so quick, so we were able to get another show in. So Stephanie is back here with me to talk to us some more. So Stephanie, go ahead and introduce yourself. Maybe the folks that weren't listening last week.
Hello, Matt. Thanks again for having me back. It's a pleasure. Yes, I'll make it brief this time in case you had already heard us last week. I'm Stephanie Pigeon with Affiliated Associates, which is an independent insurance brokerage. Started that in 2000 or 1999. Time's flown by. And we've been independent ever since. So we are not married to any particular insurance carrier. And a lot of our focus is on designing benefits for the business owner and for their employees.
Right. And this really fits the title of this, the name of my show here is Insurance Matchmaking. We're doing some matchmaking. Stephanie does a lot of things that I don't do. Her focus is primarily on small employer groups. I don't do employer insurance. I dabbled in that a few years back when I was full-time with Health Markets. Learned that, no, I really like working on the individual level and primarily Medicare. So that's kind of my niche. So we've actually already, kind of referred each other back and forth already. So we're matchmaking. So we talked a little bit last week about how one of the things that's unique about Affiliated is it's fee-based consulting versus commission-based. I don't know if you want to.
I can elaborate
a little bit on that, and then take that another step further. Hopefully, some people are tuning back in from last week.
Okay, and to give some clarity to that too. So there are sections of benefits that we work with that are still a commission-based program. So I do want to give clarity to everybody.
Yeah, that transparency, as we said.
You got it. So, and we share that with actually you're required to, by the way.
Yeah.
Employers need to be receiving a compensation. They need to have a compensation statement on file at the end of every year. Mm-hmm. So you employers out there, I hope your broker's giving you something called a compensation statement that you have on file. You need to know what your broker group is making. So in moving back to fee-based and commission, the disability, group life, the vision, the dental programs, all of those programs still pay commissions, or we call them servicing fees or commissions to us to help support the employers. But there are, as I was saying last week, there are some states that had banned commissions being paid on medical, and it particularly came about with the ACA. So we migrated to a fee-based for our medical, and the majority of our medical. There are still a few, very few. We have Tennessee, Connecticut, we were talking last week. I'm licensed in a variety of states. So there's still a few states where if we write a traditional fully insured, say Blue Cross or an Aetna or a Cigna, just to list off a variety of carriers, that those carriers may still very well pay us a commission. However, in the state of Vermont, just as a share with everybody, there are no commissions paid to brokers for the group business and the fully insured product line, and there haven't been since 2014, which really drove brokers that opted to stay in that market to a fee-based they had no choice.
Right.
I personally like fee-based, and the fee-based, we do a lot of fee-based because the plans we do design for our employers that are here in Tennessee are fee-based. There is no commission, and our fee is flat, so they'll know the flat monthly fee that we're being paid each year. And what's neat about that, Matt, is even if the premium goes a little up, if you will, hopefully not, we're controlling costs by managing things going on in the plan, right? But if the cost goes up a little bit to the employer in the renewal cycle, our fee is almost always staying the same.
Right.
So just because the quote-unquote premium goes up doesn't mean we're making more.
So you're basically like on retainer then once you've done the initial.
Yeah, absolutely. Absolutely. And a big part of what we do is we still shop every year because when we're designing plans, there's something called reinsurance in the background. So we're shopping that. We're evaluating the vendors. We're looking at, does it make sense to bring in this telemedicine company and bundle this in or peel this one out because they didn't work well last year? That's what I meant by completely. Actually, I don't know that I said it last time.
May not have.
But completely customizable.
Yeah. I was just thinking when you were talking about you started talking about some of the behind the scenes, and I mentioned last week that, you've probably forgotten more than that I've learned, and it's like I've just now some of the things you said. It's like, okay, there's something I don't know. I'm gonna have to go to one of your education sessions. Now, speaking of that, do you do kind of like you mentioned, like you educate the employers, you educate the staff? Do you do like a lunch and learn type of thing with them, or it's just that consulting when you're meeting with them? It's more educational than salesy, I guess.
Are you referring to the employers?
Yeah, like when you educate the employers or the HR people, mm-hmm. Do you just kind of one-on-one with them, or do you set up kind of more of a formal training session?
I thought you might even ask me if we would be hosting an education session for groups of employers. Were you headed in that direction?
Well, do you?
Well, I have.
Or you've thought about it?
I have considered it a number of times. We've talked about it, and mm-hmm. I've had colleagues of mine in Indianapolis and Kentucky and other areas. I didn't mention I'm part of a national network, and I'm on an advisory council for independent brokers across the nation. So we're a large think tank, and I've been working with them for about 7-8 years. And some of my colleagues have done just that. They've hosted some really great sessions where they've invited employers to come in, and they've hosted speakers and themselves as well to talk and share stories and explain how this is working and what the differences are that we're doing. So we've actually explored that idea, and I think it might be valuable. So,
especially there's so much turmoil in the health insurance industry, period. As we were talking this morning before the show, that as I mentioned, I started with Aflac, and then I went to Health Markets, got more into individual health. But my health insurance experience, I have no pre-ACA health experience. As an agent, I only know ACA. And then from a personal standpoint, I always got my insurance through the military, so I didn't deal with that employer stuff either, as a consumer. Yeah. So I just from experience or hearing people talk or kind of seeing how that's done. And I kind of learned a little bit kind of with Aflac, because that's where I learned the term cafeteria plan.
Cafeteria plan.
Yeah.
And so you don't remember the $93.75 a month family plan? I do.
No.
Now it's about $2,000 or $3,000 a
right.
month.
Fortunately, my TRICARE kind of stayed that way.
That's good. That's good. But talk about inflation. It's been one of the most inflationary issues, and it usually is, for an employer, it can very easily be the second highest cost on their P&L.
Yeah. And without being too political, that's when I say you can thank the so-called Affordable Care Act for making health insurance so unaffordable for those who aren't getting those tax subsidies.
It certainly did not help. And the promise to keep people's plans just didn't exist either. And one of the things that just angers me every year is I watch the max out of pocket that is allowed by the federal government ratchet up.
Mm-hmm.
Where are we? We're over 9,000 or 9,350 or higher now. It just keeps going up every year. And that's, again, kind of circling back to designing a plan. We're not stuck having to take just an off-the-shelf plan from one of the carriers.
Yeah.
If we can design a plan, then we can set the max out-of-pockets at a lower level, or we can adjust copays, and we can keep them that way year after year. So we can actually make that promise, Matt.
Right. Yeah. Well, other than keeping the provider, because you can't hold the provider. Unfortunately, providers can leave. If you are in a network, providers can leave networks, and they're not tied to the enrollment year. That's one of the things we run into sometimes. Of you sign somebody up, or during that open enrollment, you're looking at those network lists, and this doctor or this health group is in network in January, February, when they go to do their 6-month checkup. They go, oh, we don't take that anymore.
So that's another huge piece where we give the employer the choice. Do you want, would you like us to shop and rent a network? See, we call it renting.
It's kind of like life insurance. You want to own or rent your life insurance.
Would you like me to rent this network for you or this network for you? And by the way, we've done a search to confirm which hospitals, which doctors are in this network, and the penetration of network is really fantastic here. A little short story, side note to this, which is a network question. I just got it in my email box yesterday, I think it was. Stephanie, could you help remind, it was for a doctor's group, by the way, which I thought was really funny. I had a doctor asking me if his children would be covered under their plan because they are now in Colorado and Massachusetts. And I sent back a nice note, and I said, if you recall, we opted to rent a national network that is as strong as this other network, without mentioning carrier network names. Right. But we purposely engaged with that network, and you will be just fine in Boston, and you'll be just fine in Denver because you've got 90-something% access to providers. Yeah. And in a perfect world, I would just take the networks out again, and that's just a different discussion.
Yeah, I'm always surprised sometimes when I am talking to medical professionals, and it's like, and they don't speak my language, or our language, I should say. It's that, their terms, but I know what PRN is, which it's just kind of funny is they've taken a term that has to do with prescription and turned it to if they're working part-time.
Right.
It's a medical term, but it's like, but I deal a lot with, because what I'll run into a lot of times is folks that work at the hospital. And I will say, from what I can tell, Cookeville Regional has a great health plan for their employees while they're full-time employed. But they go PRN, they're no longer eligible for that. Also, basically, when they retire, they're not on it either. So I do work with some people that are coming off of that group plan. And that's a lot of times there's a good niche for me is, if you're coming off that employer plan, whether you're going Medicare or whether you're retiring early, maybe started your Social Security prior to 65, but you're not ready for Medicare yet. I help a lot of people with that. And the ironic thing is I've dealt with some people who are retired and fairly well off, but their money is in their 401ks or something that they're not drawing yet, or they're just drawing a little bit out. Those ACA tax credits are based on what you count as income. Your assets have nothing to do with it. So you can have $1 million in the bank, but you're only drawing $50,000 out a year. You qualify for a tax credit. So it's like, don't draw it out until you're, when you don't have to deal with it. Wait till you're 65 and go on Medicare. Then you can start drawing a little bit more out. But you have to be careful on that, too, because we have a little friend out there called Irma. One of the things I say in my Medicare 101 workshops is when I get to that part about Irma, I say, I have to apologize. I didn't know you 2 years ago. And Stephanie's laughing because she knows what I'm talking about. Social Security looks back 2 years at your income to figure out what you should be paying for your Part B. So if you're thinking about retiring or you're leaving your employer, if you have a 401k, especially if it's anything over $100,000, don't just cash it out and say, I'll just eat the tax. I want the money now, because it's going to cost you more on your Medicare, too.
That's right. People don't understand the income adjustments on their Medicare. They get very confused by that.
Right.
And I do think you're right. There's a lot of, again, let's go back to educational opportunities. There's a lot of educational opportunities for people that are coming off from the group medical plans and retiring, and then what's the best solution for them, which is where you come in, Matt. Is it their Med Sup? Is it a Med Advantage? What really, guidance there? And coming back to networks, I can't tell you how many times people get very confused. If they're considering a Med Sup, we both know that if the provider accepts Medicare, the Med Sup will pay, right? But the people get so confused because they're so used to living in the group benefit arena going, oh, wait, do they take this Aetna network or Cigna network or Blue Cross network or whatever network it may be? That's 3 different networks right there. They go to Medicare, and if you're talking a supplement, if you say Blue Cross or Aetna supplement, they panic because they go, but not in that network doesn't work. And then that's a whole other coaching session. So there are so many, frankly, rabbit holes we could go down. But I just thought I would share that.
I'm going to address that bit about the networks and the Med Sup. We're actually onto our commercial break. And I told her, like, we did the first show. If we had more time, we probably could do a third show. And we may have to come back and do it because I think we, again, like I said, just scratched the surface. So we'll be back here in a moment.
This is Emily Gibson, your local Twin Lakes security consultant. If you're thinking about a new security system, this is the perfect time to request an estimate. Twin Lakes Summer Giveaway is going on now, and we're giving away a big prize package that includes a breakaway wireless speaker, a large cooler, and more Twin Lakes swag to one lucky winner. It's easy to be entered. Simply call me at 931-528-9999 8, 2005 before August 31st for a free, no obligation, no purchase necessary quote. Or visit us online at www.twinlakes.net.
Twin Lakes Security, TN-CERT C-0026.
Hey, college students, ready to ace your dorm or apartment setup? Dive into your local Habitat Restore. Uncover unique, budget-friendly furniture, decor, and essentials that make your space pop, all while supporting a great cause. From trendy finds to classic pieces, Habitat Restore has everything you need to create your perfect pad. Plus, you can even donate your items that you're no longer using. Stop by Habitat Restore today, off South Jefferson Avenue in Cookeville, now with extended hours. Shop smart, live well, and make a difference.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back to Insurance Matchmaking and the second half of the second show with Stephanie Pigeon of Affiliate Associates. And before the break, we were talking about the networks and non-networks when it comes to Medicare supplements. I'll have people, I'll put them on a certain Medicare supplement, and what happens is, and this is what people mistake, they'll call maybe they're going to a new provider, and they'll ask them, what insurance do you have? And they'll say the name of their supplement. And they'll go, oh, no, we don't take that. And it's like, and they'll call me, they say they don't take this. And it's like, no. They think you're talking about a Medicare Advantage, and they don't take that Medicare Advantage. There is no network. When they ask you, what's your insurance, you tell them Medicare. It doesn't matter what supplement you have. Generally, and Medicare will handle that bill of I've been picking up to 20% that Medicare doesn't pay. There is no network with a Medicare supplement. That's one of the beauties of the Medicare supplement. The other is if you get it when you first turn 65, they don't ask any health questions. But if you want to try to get it later, you might not be able to. That's why generally we'll kind of encourage people to really consider that Medicare supplement when they're first eligible. But sometimes the Medicare Advantage, that zero premium is real attractive. And this is what, you may know, you probably know that. I'll get paid more to put somebody on a zero premium Medicare Advantage than a $100 Medicare supplement. So, and that's why all the phone calls and stuff, the phone lines, 800 numbers, they're more incentivized to put you on Advantage. I do both. Some people, the Advantage is a better fit for them, but I try to help people figure out and make it an educated decision on which way they want to go, and I can help them either way. So, and you were saying you wanted to come back, readdress some network things.
Well, I was just thinking misaligned incentives all the way around. As you just said, incentives. Are they the right incentives? Mm-hmm. Or are they misaligned? And I think in a lot of situations they're misaligned, without a doubt. We were talking about networks, and we didn't go to quality. How about quality of care? Mm-hmm. And quality of care is really important to me, and I'm sure it is to everyone. Is there any incentive for a carrier that has a network contract with a list of providers to tell you that provider A is better than provider B? What do you think the answer to that is, Matt?
They're not going to tell you.
Not at all. That's another big gripe that I have about networks, because I think it's really important for my customers, my employers, and my employees to be able to find a provider with high quality performance. And by the way, do you think that you can find that on Google?
Not directly. There are sources, but you have to know where to look.
Yeah. And a lot of those you have to pay for to get access to. Yeah. But there's a lot of super opportunities for people to actually learn about their providers in advance of going to them. It's not easy to find on Google, and the networks are not going to release that data to any consumer. So that's another gripe that I have personally. Here's another kind of just something that stuck with me. Actually, I want to share this with you.
Go ahead.
How many misdiagnoses do you think actually happen?
Yeah.
The actual stat is 1 in 20 people are misdiagnosed. There's a whole variety of different stats to share. And then it goes on to 1 in 20 adult outpatients are misdiagnosed every year. That's 12 million people. That's a lot. And there's also a lot of other things. The frequency and severity of errors, 50% of errors could be potentially harmful in these misdiagnoses as well.
Yeah.
So I hate to share those kinds of stats with you.
Right.
But those are the kinds of things that I actually talk to my clients about. 55% of spine surgeries are misdiagnosed. And I do have, by the way, sources for all of these if you need to know sources. This one was from Edison Healthcare. Those are important because if people are misdiagnosed and they're receiving care, what do you think their reentry is going to be like?
Yeah.
they're going to be readmitted, which is
Right.
driving up costs too. So when we're actually designing a medical plan and we build in a solid medical management team to assist the members with some of these things, we encourage second opinions. As a matter of fact, I got a phone call yesterday from one of our clients that said, Stephanie, you remember this employee? I said, I certainly do. You think maybe you could put a little note out to one of the nurses that he's very interested in a second opinion this time around? And I said, not a problem. This gentleman's going to seek a second opinion, Matt, and he may very well fly to somewhere like Oklahoma because that's where they do more surgeries for what he needs. It'll cost less, and he's not going to end up back in the hospital.
Right.
The first time he went through what he was going through, he didn't want to get a second opinion, and he didn't want to take any guidance. Now he's back and asking for help.
Yeah.
And the good news is we can help him. But do you think you find that in a network?
And that's why one of the things, that just kind of a segue of, especially if I'm talking to somebody on a Medicare Advantage, but even a Medicare supplement sometimes, is having a supplemental plan for cancer coverage. The changes in the drug coverage, there used to be one of the things there because, those expensive drug costs, you could still have a 5% charge on some of those drugs, and then it will hit your pocketbook severely, and a cancer plan will kind of help pad that. Your health care is covered, but the other thing is, too, you may want a treatment that's not covered by Medicare. Or you want to see, or there's this special oncology place that that's where you're supposed to go to get cured cancer. They don't take Medicare. If you're going to have to pay out of pocket, it's nice to have maybe a $30,000 or $40,000 cancer plan. You can take that cash and say, okay, my insurance is not paying, I'm going to pay this. The other thing is, I always say, you ever notice that Southwest Airlines doesn't take Blue Cross and Holiday Inn does not take Humana? Your insurance doesn't cover those other expenses that come up when you have a serious condition, and that's where the supplemental plans can be very instrumental. Yes, we make a commission on that. Yes, we want to, but we also want to make sure that you and your family are properly protected. And so sometimes some of those supplemental things, the packages.
Here's a perfect share, Matt, on that. So let's say we have a health plan in place that helps steer a member to go to, I don't know, I'm just going to say MD Anderson because many people know they're great for cancer.
Right.
In a general sense, right? Mm-hmm. But it really boils down to the physician. Who's the surgeon you're actually seeing? Yeah. Okay, but let's just as an example say that we have a plan that affords them that opportunity and supports them to do that on the medical plan. And then let's assume maybe they bought a critical illness policy from you. So they've got a win-win, right? They're getting to the right place at the right time for the type of diagnosis they have by the style plans we design. And then if they have a, say, $20,000 critical illness policy that maybe you help them set up, upon that diagnosis, that family, did they not just get a check for $20,000 to help them with ancillary expenses? That, to me, is the perfect win-win.
Keeping an eye on the clock. I want to make sure we don't run out of time. I actually will go ahead and hit it now. We're not at the end. We still have a few minutes left, but I do want to go ahead and give you the opportunity so we're not rushing it at the end, of how people can get in contact with you.
Well, we'd love to hear from people. And, I'd love to hear from our businesses in the community. If they'd like to have a general session of education, we would be more than happy to put something like that on. I think it would be very beneficial to share some of these things with folks. And it's always nice to do that with a group of employers in a room, because one person will think of one question and it'll spear another question. So it's a great collaborative opportunity. So you can reach us at Affiliated Associates by going to our website, affiliatedassoc.com, or you may certainly give us a call as well, 931-742-0004. And if you can't reach Stephanie, please ask for Renee. Either one of us would be happy to help you.
All right. And as I've mentioned, always, if maybe you were driving and didn't hear that number, or you can always go to insurancematchmaking.com and message us. Also, our past shows. If you're listening to this on the radio, all our past shows get added to a YouTube, so you can go back and re-listen to a show, or go back and you can rewind and get to where that phone number is. It's usually a couple weeks after the show airs that we get that up on the website. But great webmaster with Fast Track Solutions that created my website, and they do that. They take these recordings and get those on YouTube for me, so that works out great. We've got about 3 minutes left, so is there something we can squeeze in that 3 minutes without having to cut it off? You mentioned to me earlier you've got a couple books. Or you want to talk anything about your books?
Sure. I had the great opportunity of doing a collaborative book several years back called Breaking Through the Status Quo. And that was with the network that I'm part of nationally, the independent brokered network. So we had a great time doing that. We all picked different topics that were important to us, and mine happened to be no network health plans. So and how you have to understand your area and the receptivity of a hospital or the provider area, because there needs to be some understanding of how those work. And then in the last 2 years, just did another collaborative book, Fixing American Healthcare. And I don't know, that's a daunting task.
Yeah. Did you feel like Don Quixote, huh?
Right,
tilting at windmills.
Right. And in that one, I really focused in on prescriptions. That's a topic all on its own.
And I do want to mention, I've noticed you're wearing your Rotary pin. Would you like to share anything about your Rotary?
Oh, I'm so excited you asked me about that. I was almost going to ask you if we could do just a session on Rotary.
Well, we maybe can come back to that, but you can touch on it now. Like we got like 2 minutes.
For those of you that don't know, Rotary is an amazing organization that has 32,000 clubs around the world, and they actually change their president every year. Can you believe that? And they still function. So it's pretty neat. One of the things about Rotary for me was it was a graduation from 4-H to Rotary when I was younger, where I could continue community service. We do a lot of super things in the community for kids and seniors, and then it expands to international. And those of you that don't know, you've probably heard about Polio Plus programs and eradicating polio worldwide. Well, Rotary was really behind all of that long before anyone else joined in and added additional funds.
That's awesome. Yeah, I know in Pigeon Forge there's a very nice park right there in Wares Valley. The land was donated by the Ware family, but the park is a Rotary park. It's a beautiful park. We stay at the Blue Green, and so sometimes I would go. My wife, a lot of times we go to Pigeon Forge because she's going to the quilt show.
Well, I'm going to steal a chance to say something.
Okay, go
ahead.
If
I may. I got to put this plug in for my Rotary Club in Crossville.
Okay, go ahead.
So please come join us. Every Thursday, we meet at the Depot on Main Street in Crossville. And we'd love to have you as a visitor if anybody's coming through town that week.
And you meet what time?
We meet at noon.
And you're noon, so you're at lunchtime.
We're at lunchtime.
Okay.
Yeah.
That is good to know. Again, Stephanie Pigeon with Affiliated Associates. It's affiliated Assoc. She got the full word out. It's like she's like kind of probably like me. I like shorter web addresses, and when you have to type out too many letters, it gets harder to remember them. But been great having you on the show today. Hopefully, I think we're going to have to do a couple more probably, and we're going to get Renee on here too. Believe it or not, Renee's been here with us the whole time, but she said she wasn't going to talk now, but she's taking copious notes, so I think we've got a bunch of stuff to talk about later. I wanted her just to say hi, and she didn't even want to do that. So anyway, thanks again for tuning in to Insurance Matchmaking, and until next week, see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.